Now we will discuss the complications of obesity, and first is there is increased risk of stroke in people who are obese. They have increased chances of developing stroke because mainly of increased in the blood pressure, hypertension and diabetes, which are two common complications of obesity. Then there is also increased risk of developing depression. Sleep apnea is very common in people who are overweight and obese. There is increased risk of heart attack in patients who are obese. There is high blood pressure, increased blood sugar level. Obese people, they are diabetic, and there is also a risk of heart attack because of arteriosclerosis, which is hardening of the arteries. The main factor that leads to the complications of heart or the heart attack as a result of obesity is insulin resistance that develops in patients who are obese. And this insulin resistance then leads to increase in the triglycerides level. There is increased PAI1, increased level of uric acid, increased low density lipoproteins, and also there is decrease in high density lipoprotein. High density lipoproteins are good lipids. Low density lipoproteins are bad lipids. So if you see there is increase in low density lipoprotein, which is itself is a risk factor for heart attack or heart problems. And then there is also glucose intolerance. So all these as a result of insulin resistance that occur due to obesity leads to complications like hypertension, hypercoagulability, atheroscleroma, and coronary heart disease. These all complications can ultimately lead to heart attack. Hypercoagulability also due to development of clotting factors or big clots form in the arteries that cause the obstruction and narrowing and leads to the heart attack. So all these can lead to the heart attack, and this is mainly due to development of insulin resistance as a result of obesity. Next complication is liver diseases. Liver is also very commonly affected in patients who are overweight and obese, and this is mainly due to increased free fatty acids. Free fatty acids can lead to dysfunction of the adipose tissue, and this cause increase in the cytokines like tumor necrosis factor, interleukins. It also cause increase in leptin resistance, and this cause decrease in adiponectin. Increased free fatty acid, how it can cause damage to the liver, it causes fatty liver. Fatty liver is very common complication of the liver that is present in people who are obese and overweight. Then fatty liver, there is increase again tumor necrosis factor and interleukin, which are cytokines, and this also cause is non-alcoholic hepatitis and fibrosis of the liver. The liver becomes shrunken, it becomes fibrosed, and the functions of the liver are affected. And then these can ultimately lead to cirrhosis of the liver, in which the liver cells are damaged and destroyed, and it's a very serious complication of the liver. So obesity can cause liver cirrhosis, it can cause liver fibrosis and fatty liver. This and all because of increase in cytokines and decrease in adiponectin. Hepatic carcinoma, cirrhosis of the liver. If you see the chances of cirrhosis of the liver to develop into hepatic carcinoma are very high. So ultimately, hepatic carcinoma can occur as a complication of obesity. Gastroesophageal reflux disease is also very common in this. There is reflux and there is acid burn because of the pressure on the stomach. There is reflux and cause the burning. Cancers, different cancers can occur in people who are obese. We have liver, kidney, colon, pancreatic cancer, and then also the cancer of the reproductive organs is also common. And the reason behind that, pathophysiology of the development of reproductive system organ cancer is again insulin resistance, which causes hyperinsulinemia. There is decrease in growth, insulin growth factor binding protein, decrease in the binding protein. And when there is decrease in the binding protein, what happens? There is increased in the growth factor, and this increase in growth factor causes increased production of androgens, increased peripheral aromatase activity, and increased free estrogen levels, and all these can lead to the development of cancer. Then we have gallstones. Gallstones, again, we have uric acid levels are increased, we mentioned before. And this increased level of uric acid is one of the common cause of formation of the gallstones. Skin fold rashes occur as a complication. Kidney failure. Kidney failure is another important complication or serious complication in patients who are obese. And this kidney failure is due to different factors. One, there is glucose intolerance, and there is renal vasodilation. Renal vasodilation. There is glomerular hyperfiltration, kidney compression, increased renin-angiotensin adrenal system, and increased leptin. This can cause proteinuria. More protein is leaked in the urine, and it can cause glomerulosclerosis and cause kidney disease. Now, kidney compression and renin-angiotensin system, when it is effective, it causes increased reabsorption of the sodium, and it causes decrease in the pressure natriuresis. There is expansion of the volume. Sodium can cause retention of the fluid. So when there is increased in the sodium reabsorption, definitely more fluid is absorbed. There is volume expansion, and there is also atherosclerosis. This can cause hypertension, and again, hypertension can cause glomerulosclerosis and kidney disease. Increased leptin again cause increased sympathetic nervous system, and there is vasoconstriction. Vasoconstriction itself can cause hypertension and glomerulosclerosis. Another complication, type 2 diabetes. Type 2 diabetes is very common in patients who are obese. Infertility due to overweight is again very common due to irregularity in the cycles and ovulatory cycles. Then there is weakening of the muscles and bones because of the increased pressure on the muscles and the bones. Myalgias are very common, and then there is compression of the bone, and because of increased bone and demineralization is common in obese people. Then finally, there is another very common complication, that is osteoarthritis, which is inflammation of the bones and the joints. So all these are the complications of obesity, and they are very, very common complications that can affect the individual who are obese and overweight.